Hi, everyone, and welcome to the SMS Patient Registry webinar. My name is Allison Stefanok, and I am the Education Chair for PRISMS. Thank you all for joining us this evening for our first webinar brought to you by PRISMS. PRISMS is dedicated to supporting and providing information to families with individuals with Smith-Magenis syndrome. Also, PRISMS is dedicated to sponsoring research and fostering partnerships with professionals to improve awareness of Smith-Magenis syndrome. The PRISMS Education Committee is working to find more dynamic platforms to share information with the SMS community, such as webinars like these. So a recording of this webinar, as well as all of our future webinars, can be found on the PRISMS website at prisms.org under the Education tab. So before we get started, I want to let everyone know that if you have a question during the webinar, you can type it in the Q&A box at the bottom of your screen. At the end of the presentation, Theresa will take some time to answer a few of our questions live. She may not get to all of our questions, but we'll do our best. And we also have a $50 Amazon gift card drawing to do tonight. So the winner of that drawing will be announced in the chat function, which is also at the bottom of your screen. The chat is read-only for our audience, but the winner of the drawing will be announced there. So keep an eye on that, and good luck. So our topic for this evening is the SMS Patient Registry. Theresa Wilson is our presenter this evening, and she is going to be teaching us and sharing more about what the registry is, why we need it, and how you can participate, including the new online consent procedure. So Theresa works as a research coordinator at the Molecular and Human Genetics Department at Baylor College of Medicine. Her responsibilities include management of the SMS Patient Registry, as well as other studies that involve individuals with Smith-Magenis syndrome. So thank you so much, Theresa, for the work that you do to better the understanding of Smith-Magenis syndrome, and thank you also for volunteering to be our very first webinar speaker.
Thank you, Allison, and thank you, PRISMS, for inviting me to take part in this webinar series. I'm very excited to be part of the team that works with PRISMS and that tries to improve the lives of individuals with Smith-Magenis syndrome. So like Allison said, tonight we're going to focus on the patient registry, and I'll try to remind you a couple of times throughout the presentation, because I'm sure more people will be joining, that you can ask questions at any time by using the Q&A function at the bottom of your screen, and we'll answer all of those, well, not all of those questions, but we'll address those questions at the end of the webinar. So this evening I'm going to talk about the patient registry, kind of describing what it is, why it's important. Then I want to talk about a brand new process we have for doing informed consent online. If anyone listening tonight has tried to join the registry before, it used to be kind of an arduous process of phone calls back and forth with me, verifying that you've read the consent form. And that's just difficult with anyone, and especially someone who has a child at home that might need special attention. And so it's been a real roadblock, I think, for some people joining the registry. So we now have an online process for that. We'll talk about where the data that you submit to the registry is stored and who has access to that, how it's controlled. And then we'll actually talk about the questionnaires and surveys that we have on the registry. So what you can expect to, what kind of information you can expect to share when you join. And then we have a couple of exciting updates about where the registry is today. So first, like I said, we'll talk about the patient registry. And this is an outline of what I'll cover here. What is a patient registry? Why do we need one? Who is eligible to participate in the patient registry? What is needed to participate? How do I do that? And what is involved with participation in the registry? So first of all, a patient registry is a very large database. It's used to collect and store large amounts of information, and that information is collected over a long period of time. This registry will be used as an online tool to collect and store medically relevant information on individuals with SMS. So imagine if you have the same questions asked of many people with Smith-Magenis syndrome, you're able to really see the natural history of the disorder and what happens over time as people with Smith-Magenis age and what you might expect. For families who first got a diagnosis, say 20 or 30 years ago, there was really no information out there for that kind of thing, and you didn't know what to expect. But now that the disorder is more well recognized and being better diagnosed, and more people recognize what it is, we can start to piece together what we might expect from individuals with Smith-Magenis syndrome. And so a patient registry is really useful for tracking how things might change for these individuals over time. So the reasons that we need a patient registry is really to allow researchers to better understand the natural history of SMS. It allows for the collection of similar information in one streamlined way. And I can't say how important this piece is. Smith-Magenis is such a rare disorder, and there are very few researchers actually working on it, that if we don't work collaboratively and have similar information on every subject, it's really difficult to come to any kind of consensus about what's really happening. For example, your child might have, they might start developing tremors, and you're like, well, is that related to Smith-Magenis, or is that just some other thing that's happening with them? And you wouldn't have any way of really knowing, because there's no comparison or baseline for what happens to the majority of individuals with this condition. But by having a registry and collecting that kind of information, we can start to say, yeah, it looks like the majority of individuals with SMS do start to have a tremor. And I'm just throwing that out there. I'm not saying that that's something we see, but for parents who wonder, it's nice to be able to look at empirical data that says, yes, this is something we see in the majority of patients, or no, it's not something that we see. It also leads to improved understanding of Smith-Magenis so that we can improve the care for those individuals. Who's eligible to participate in the patient registry? All individuals with a molecularly confirmed diagnosis of Smith-Magenis syndrome can participate. This includes individuals with the common 17p11.2 deletion, an uncommon 17p deletion that includes the RAI1 gene, or a pathogenic variant of the RAI1 gene. We do require genetic test results to be added to the patient registry. I've talked to some individuals over the last year and a half whose child was diagnosed so long ago that they don't really have a molecular confirmation. And we really do need that kind of information, because one of the things that we think may be important is looking at differences between those individuals who have a mutation or a pathogenic variant in RAI1 versus those who have a deletion. And there are also still some people who are misdiagnosed with Smith-Magenis because the phenotype overlaps a lot with some other conditions. And if the diagnosis isn't confirmed with the genetic test, we could potentially have people in the registry that don't really have Smith-Magenis, and that would skew our data. So we do require that genetic testing be provided so that we can verify the diagnosis. Okay, so to participate in the patient registry, you are required to have a signed consent form, which is now available online. It's very exciting. It used to be only a paper trail that we had to do. We do need a copy of the child's genetic test results. And then we also need proof of the parent's identity if your child is a minor, or legal guardianship for adult children. So we need to be able to substantiate that the individual answering questions on behalf of the child with Smith-Magenis, that they really have legal authority to do that. And so that's what we establish with proof of identity or guardianship. And then, like I said, we need those genetic test results to confirm the diagnosis, and the consent form, which now is available online. Excuse me. So the types of genetic tests that we can accept are karyotype, a FISH, chromosomal microarray, RAI1 sequencing, and whole exome sequencing. If you have many more questions about the specifics of those, I think you might hold out for the next webinar where our genetic counselor will be speaking. I don't have a strong background in genetics, and my explanation of those would probably be lacking. So I will just tell you to hold off for the next webinar. Okay, so what kind of information will you expect to be collected online if you participate in the registry? All the information we collect is medically relevant to promote better understanding of the natural history of SMS. These would include things like the genetic test results, sleep studies, hearing tests, spinal x-rays, photographs, audio tapes, videotapes, and then also questionnaires about sleep habits, quality of life, movement disorders, hunger. And I can tell you this is a very broad list of things that we think we may be collecting at some point. We're not asking for all of that information currently, but we think in the future we might want to add that. And so when we wrote our protocol, which is approved by Baylor College of Medicine, we wrote it rather broadly so that when we want to add these things, it's already included in the Institutional Review Board's approval. Right now, all we have in the registry are some questionnaires, and they focus on medical history, medications, and demographic information. But we are hoping very soon to add some quality of life measures, movement disorders, hunger scales, and those kind of things. Okay, so to participate in the registry, the easiest way to do this now is to follow the link that's on your screen. It's www.prisms.org/research/SMS-patient-registry/. This will take you, and I have a screenshot of this in a few slides, but it will take you to the PRISMS website where the patient registry is discussed. And at the very bottom of that page, there are two buttons, and you can select either you want more information, and you can select that. It sends me an email directly, and you can ask me some questions. Or if you prefer to do a paper, old-fashioned consent, we can do it that way. But if you're ready to start the online process, there's another button that you can click on which says, I'm ready to enroll. Okay. You're also welcome to email me directly at prisms.registry@bcm.edu. That alias goes directly to me, so I will be happy to get back to you. Okay, so what does participation in the registry involve? Right, what happens is you get a personalized link to complete online questionnaires. Like I said, those questionnaires currently include demographics, medical history, developmental history. We're hoping very soon to add sleep history and weight history to that. And as you go through the registry, you can complete the forms just as much as you can at one sitting. And then when you sign out, it will give you a link so you can sign right back into where you left off. So you don't have to do all of them at one time. So that's a really nice feature. You can always come back to where you left off. And once we have kind of a core set of surveys, you don't get bombarded by emails several times throughout the year asking you to do another survey. We will have a core set of surveys that we want everyone to complete when they first register. And then the ideal is maybe once a year, we would send kind of an update. Okay, has anything changed? Are the medications different now? Any new medical concerns that you want to add to the medical history? And periodically, we might start working with another collaborator who has a specific interest in, for example, sleep medicine. And they might have another form that they think is really useful and would be very pertinent to this population. And so they would ask us, let's add this to the registry, and we would send one email to everyone in the registry and ask them to complete that form. So like I said, it's not something where you would be getting lots of emails frequently about, okay, fill this out, okay, fill this out. Excuse me. Right now we're still, we're about a year into having the registry, so we are still adding some forms. But like I said, once it gets really set, we would have a core set of those kind of surveys or questionnaires, and then you could expect something new maybe once a year or something on that order. Okay, so let's talk a little more about the online consent process and what that looks like. So when you click on the link that I provided a couple of slides ago, and again, it's here at the top of this page, this is the page that it takes you to. And as you scroll down that page, you get to the bottom, and this is where it says, if you have more questions, you can contact us, and that email, anything you type in there goes directly to me. If you're ready to enroll, then you can click the Enroll Now button. If you've started the process before, or you're not sure if you're in the registry, You can go ahead and click contact us and send me an email. I can confirm if you're in the registry or not. Or you can even do the enroll now process. I'm not going to enroll you twice. So if I find your name's already in there, I'll let you know that you've already registered. And if you've completed all the surveys that are currently available, I can let you know that. So when you click that enroll now button, this is the first screen that pops up, and it explains that there are 3 steps to completing the online process. The first one is that we need to establish a legally authorized representative. What this means is we need to know if your child is a minor or an adult. If they're a minor, we're going to ask you to upload proof of your identity. If they're an adult, we're going to ask you to upload proof of guardianship or power of attorney. If you don't upload one of those items, you can't get to the rest of the consent process. So it's specifically it's using branching logic. So if you don't do those first steps, you won't get to the next step. So if you read this first page, you might think, okay, let me get my forms, let me get my ID ready, let me get my genetic test results ready. So when you sit down to do this, you can complete the whole process in one sitting. And if you do that, I think it takes maybe 20 minutes. But again, that's if you already have your proof of identity or your legal guardianship papers right there ready to upload. And also the genetic test results need to be ready to upload. Okay, so kind of got off track there. So the first step, establish legally authorized representation. Second step is to actually go through the informed consent process. So when you go through this, you'll see it'll look like a paper consent form. You can read through it, and then it will ask you some questions about the page you just read. You need to answer those questions correctly or you can't go forward, okay? So this is part of the process of informed consent, which when we do it on the phone, I'm verifying that you understand what is in the consent form. When we do it online, we have to have another way of verifying that you've really read what's on those pages and that you understand what this study is about. This research study is, patient registry is very, very simple, very straightforward. It's not harmful at all. There are no risks involved. But there are other studies out there that do involve more risks, things like clinical drug trials or, anything like that. And they have an informed consent process, and that process is the same. And it says that I'm going to tell you everything that's in the research. You have a chance to ask questions. And then when we're both satisfied that we understand what's involved with the study, then you can give your informed consent. So even with very simple studies like this one, we still have to follow the same process. So that's step 2. Step 3 is uploading the genetic test results. Okay. It reminds you again right here that if you have additional questions or you want to ask a question before you get started, you can email me at prisms.registry@bcm.edu. So this is, if you were to click next page, this is what you see is the individual with SMS currently under 18 years of age, yes or no. And then you will see if they're under 18, we're going to ask you to upload some type of identification. We're going to ask you to describe what that identification is. And then I didn't include screenshots for it, but if your child is an adult, it's a similar kind of process where you upload proof of guardianship. This is the first page of the consent form, and you would be able to read that as you scroll down the page. Then you see there are a couple of questions that pop up. Excuse me. So you're able to answer those questions just by clicking on the dots there. If you don't get both questions right, you won't be able to go on to the next page. There's also going to be, and I didn't include the screenshot, but there's also an opportunity at the end of every page of the consent form to ask questions. If you have a question, you can write it in there. I will get that question and be able to get back to you, but you won't be able to advance through the consent form. So if you say, no, I don't have any questions, you'll be able to advance through the consent form. And there are a total of 5 pages for that. And there's a place where you can sign, and you'll be able to download a copy of the consent form for yourself to keep. So that's all built into the online process. What I have here on this page is where you upload your genetic test results. It looks very similar to the other screens where you're able to just upload the document, tell me yes or no if you did it, and the computer is pretty smart and knows if you uploaded something, and if you did not, you won't be able to advance. So that's the last step of the process. There will be a slide that comes up and it says a lot it says something very similar to what's on this slide, which is we've received your online consent forms. We'll review them for completeness in the next few days. If your file is not complete, you'll be contacted regarding successful completion of the process. If the file is complete, then you will be added to the patient registry and receive an email with a link to complete your first questionnaire. So what might happen that results in an incomplete consent process? Okay, when you upload a form or when you upload guardianship papers or your genetic test results, the computer doesn't actually know what you've uploaded. But so I have to physically look at those documents and make sure that it's the information that we need. So if you upload something that is insufficient or doesn't have the information we're looking for, then I will get back to you and say, hey, those genetic test results that you submitted didn't have all the kind of information we're looking for. Can you look in your file again and see if maybe there was a second page, or maybe you had something from a genetic counselor that's more thorough, and I can let you know what else we might need specifically. If all of that information is complete and we have the right documents, then I just have to add you to the registry, and then I click a couple buttons and it will send you a link to your first questionnaire. When you complete the first questionnaire, then it will trigger the second one and the third one. And we'll go into that in a second. This is a screenshot of what you will see when you do get registered in the patient registry. This is the first thing that you'll see. It's just a description of, welcome. It's just something welcoming you to the patient registry and gives you a link where you can click to start your first survey. It's very user-friendly when you open that up. So now I'd like to tell you, because I'm sure people are curious, where the data is stored and who has access to it, right? This is health information, and you need to know where that information is and who can look at it. So all the data is stored on a secure server. It's called RedCap, and that server is located at Baylor College of Medicine. It's a secure web application used for building and maintaining online survey databases. So you can certainly look that up for more information if you would like to. Other researchers that are interested in SMS can have access to the data if we grant it to them, and we do that in a de-identified manner. So what that means is no one can just go in and look at it on their own. They have to submit a request to us and ask for access to it, and we want to know, well, what do they want to do with it? What kind of questions are they going to be asking? What sort of analysis do they want to run with the data? And if we think that it's worthwhile, then we can share the data with them, but it's in a de-identified manner. And so what that means is there are no names included, there are no personally identifying information. I mean, we will give them information like gender or date of birth, because those things are important when we look at data. So they would have that information, but they wouldn't be able to link it back to specific individuals. So it wouldn't include name, date of birth, email address, or phone number. I have to check on date of birth. I mean, maybe we just give them age, but I would think we can give them date of birth as long as we don't give date of birth and name. So I can check on that one. And any collaborators that we work with, this is something that would that we would talk to the advisory board for PRISMs with before we make those kinds of decisions. It's not just one person who makes that kind of decision. You might wonder why other people should have access to your data, and that is because learning is enhanced by joining forces with other researchers interested in Smith-Magenis. Some of our collaborators may specialize in a certain aspect of SMS. For example, a psychologist can study behavioral aspects. A sleep medicine doctor can focus on sleep disturbance. I don't think I mentioned it at the beginning, but I am at Baylor College of Medicine, and I work with Dr. Sarah Elsey, and we are the ones who manage the patient registry from the IRB side of things, and we have institutional review over that. And so it's run through Baylor College of Medicine. but we don't have all the expertise that other researchers have across the country. And so we might have, someone who has a stronger background in some of these other areas actually look at that data. They may also, like I said earlier, they might also suggest certain surveys or questionnaires that we could add to the registry to really hone in on those questions that are important to people affected by SMS. Okay, so what does the actual registry look like? We've talked about what the online consent process looks like. We've talked about where the data is stored, who has access to it. When you finally get registered and you get that first email that says, okay, click on this link and do your first survey, this is what you see. We're going to ask about the caregiver's contact information first. And then as you scroll down the page, in there we do ask about contact information. Then we ask about the participant's contact information. It's pretty basic demographic information. I don't think you'll have to look anything up for that form. If you sign out, right, I said the database saves your information as you go along. So if you do need to sign out for any reason, you can pick up where you left off. And this is what it will look like if you sign out. You'll get a return code. And so you'll need to hold on to that so you can sign back in. Okay, and every form kind of has that same sort of layout. Like I said, there's a demographic form, there's a medication log, there's a medical history form. And that might be one, when you sit down to do the medical history form, you might want to pull out some of your child's medical records, because it will ask things about, if your child has a heart condition, yes or no. If they do, at what age was it diagnosed? Did they have hearing loss? Do they have visual impairment? All kinds of, it goes through pretty much every system of the body and asks about those kind of questions. So if you want to have that information with you when you sit down to do the medical history form, it might be useful, because it does ask those questions about at what age the diagnosis was made for those different kinds of issues that come up. Okay, so I wanted to give you a little update on what's going on with the registry right now. We currently have 55 families enrolled. The registry was launched about 1.5 years ago. We certainly thought these numbers would be higher, and we've had nearly 100 inquiries from people who are interested in joining the patient registry, but it's really been challenging for families to complete the online consent process. And I think it's just because it involves, coordinating a phone call here or there, and they have to find their genetic test results, and things happen and families get busy, and it's hard to follow up on those kinds of things. So we're really hopeful that this online consent process will streamline everything and make it easier for families to join the registry. If you're not technologically savvy or not interested in doing it online for any reason, you still have the option of doing it the old-fashioned way, and I'll be happy to email you a consent form and we can have that phone call conversation. But the process we have in place now is really user-friendly, and I think it will be very helpful for families. Okay, so our short-term goals are to add some new surveys. We want to look at surveys for sleep disturbance, movement disorders, and also eating and hunger. We have some ideas about what surveys we want to use for that, but we also want to check with some other SMS researchers who are a little more experienced in those areas and get their opinion. And then we'll run all of that through the PRISM's advisory board, and make sure that they agree that those are the kinds of questions we should be asking. The other thing that we're doing, and we're actually moving really fast on this piece right now, is to translate the consent process and all the surveys into multiple languages. The languages that we're working toward are Spanish, Italian, French, and German. And I have an intern who's helping with this summer, and I'm really excited that I think we could get this done. I don't want to say how soon, because as soon as you give a date or a time, then something happens and it's later than you think. But we're hoping to add that piece very soon. It's important for us to be able to make this patient registry international, because Smith-Magenis, again, is such a rare disorder. If if people try to replicate the registry in other countries, it really kind of diffuses the information that we're collecting. And so if we can get everything into one database, that gives us a lot more power from a research perspective, and a lot more ability to look at things that are statistically significant. And we can say with a little more certainty what parents might expect moving forward with this, if their child's affected with this condition. So that is pretty much it. I'm happy to take any questions that you guys have, and we can just go from there.
Thank you so much, Theresa, for all of that information on the SMS Patient Registry, which is, like you said, so important for medical professionals and researchers to improve the understanding of Smith-Magenis syndrome. So now we have some time for Theresa to answer a few questions for us. We may not get to all of the questions, but she is going to answer a few of them live for us. So let me take a look here. Our first question is, hi, thanks for this webinar. And thank you all for being here, appreciate it. And so it says, I think I put my son on the registry, how can I check?
Your name looks really familiar to me, and I think that we had a difficult time getting you on the registry. So if you can, because I don't have a perfect memory, can you send me an email to that prisms.registry@bcm.edu, and I will double check. I want to say you're in there, but send me an email and I will double check and then respond to you directly.
Okay, thank you, Theresa. Next question is, how long after completing the registration should we begin receiving the surveys?
Okay, so this is gonna land squarely on my shoulders because what happens when you complete the online consent process, I need to review the documents, and as soon as I do that, I will put you in the registry. My goal is to review the documents at least once a week. So I would say give it, 1 week's time. Hopefully sooner than that I can get it done. I'm really going to be focusing on it in the next week because I think a lot of people on the webinar might try to go ahead and do this. I'm hoping you guys get on and try to do that. So I'm going to make a real effort to check it every day this week. But if you don't hear something, I'd say within a week, then certainly send me an email and I'll let you know where you stand in the process.
Thank you, Theresa. Okay, our last question for the evening, actually we have a couple more. So our next question is, once I'm registered, I've completed the questionnaire, but no other test. I have MRI, hearing, and loads of other tests. Should I send any other test results? If so, how?
Do not send any other tests currently because we don't have a good place to put them right now. And like I said, it needs to be stored in an environment that is protected. I forget the technical names for it, but like a secure website and all of that. And so I would say keep that information close, and the goal would be that we can start asking for it soon, but I wouldn't send it until we ask for it. Yeah. Okay.
Thank you so much. We have another question here. Will there be a collection of data regarding educational interventions, especially elementary?
I think that's a great suggestion. I'm not aware of that being something that we're looking at right now, but I think that's an excellent question. And I can see where that would be particularly helpful to parents today, to see what other parents are doing. So we'll take a look at that.
Okay, thank you, Theresa. And I have one last question. What is the literacy level of the instructions for the registry?
Oh, that's a good question. Okay, so the consent form, okay, instructions for the, so to me, this is a two-part question. So the literacy level for the consent process are the informed consent like those 5 pages are about a 6th grade level, I think. And when I added the contingency questions at the end of each page of that, it had to be approved by the IRB as well. And they typically look at the consent forms and want them to be about a 6th grade level. They didn't come back to me and say that the questions I added were too advanced. So I'm gonna say I think it's about that level. But we didn't have someone actually review it for literacy level. We do have access to a developmental pediatrician though, and we could do that. But I'm assuming pretty much everyone doing the registry and the consent process is probably the parent or caregiver for an individual with SMS. So I think, I don't know, I guess, I think it's a pretty good level for people, but we didn't formally, that I know of, look at that.
Thank you, Theresa. Thank you for answering all those questions. And thank you so much again for speaking at our first webinar. We really appreciate it. I hope everyone enjoyed this presentation this evening on the SMS Patient Registry. Please do plan to sign up if you haven't done so already. Also be on the lookout for an email with a link to the recording of this webinar. Of course, it will also be available from the PRISM's website as well. And the email will also include a survey, and please take some time to fill out the survey because we would love to know how we did this evening. And also please remember that the SMS Patient Registry, as well as this webinar program, are funded through PRISM's. So please do consider donating to PRISM's so that we can keep this and other vital programs from PRISM's sustainable. So that concludes our webinar, and I hope everyone has a great evening. And thank you all for joining us, and good night.
Thank you very much.